Hello everyone, hi, how are you? This is Dr. Ibrahim, and in this video, I'm going to talk about some avoidable mistakes in dealing with angry patient or angry relative. First of all, long time no see. Inshallah, in the next days, I will upload more and more videos and will return back to doing online mocks, and then we'll do group mocks very soon. I will announce everything very soon. So, coming back to dealing with angry patient or angry relative, this is a common station in PLAB 2 exam, and it is also a common station, a common situation that you will face while you work as a junior doctor or even a senior one. Okay, so angry patient or angry relative might have a logic reason for that, or in many times he doesn't have any logic explanation for being angry. He's just angry. But you have to deal with both situation by the same approach. Okay. First of all, your role is to support the patient. Your role is to support the patient. It's not like an argument, and you have to prove you are right and the patient is wrong, or you have to prove your point of view. The most important point in this situation, especially in the exam, is to support the patient. Okay, I don't mean by that to accept the patient point of view, but you have to be supportive more than starting an argument, because in the exam time there is no time for that. Okay, suppose this patient is angry because he is waiting for long time, or he like mm, he waited for long to be discharged or to have a cannula or to have his medication, or he's angry, a relative, a mom or a dad is angry about the medical service they got for like a child. So there is many situations that you will face this angry person. So first of all, support. I'm sorry for what you have been through. I'm sorry for your feeling. Okay, so you should start your approach by supporting. Sorry here doesn't mean that you admit that there is a mistake happen, but it is just for support. Okay, common mistake here is that many people start with explaining or start arguing with the patient or with the relative about what happened. Like if someone waited for a long time, yeah, this is the usual waiting time here in the ED. This is the usual. No, it shouldn't be done. Is it? You can say that later on after the patient will calm down and will give you uh, like he will be relaxed to accept what you will say. But in the start, you should support. You should say sorry, and after that, try to acknowledge. Try to ask the patient why he is angry. Okay, take it step by step. So what's happening? What happened? What made you angry? Okay, and try to correct the situation. Okay, sometimes the patient will get something wrong, so you have to correct it. Okay, or you have to explain it in the right way. Okay, or you have to give an excuse for what happened. Okay, like he's waiting for a long time. You need to explain it in a nice way. Okay, that it is not is out of your hand. Acknowledge you. Yes, I know that you waited here for a long time, but it is out of our hand. The EN is always busy. There's a lot of patient, a lot of many sick patients. I know that you sick, you tired, you have this and you have that, and I understand the situation. But yeah, we are short staffed if there is like a mention of something like that in the scenario. If if there is a patient angry about something that you haven't done or you don't have any knowledge about it, please don't give an explanation or a false explanation about that, but explain that you will investigate about what happened. Like one of the patient, one of the relative will talk to you about one of the colleague and will give you a story that you don't ever know anything about it. Okay, so first of all, support, give an apology, and after that explain that you will have a talk, you will need to speak to your colleague, or ask the patient if it is suitable to speak to your colleague directly, or mention that you will ask your colleague to come and speak to the patient and explain what happened. Even sometimes the family or the relative or the patient might say something that it is like it's very clear that it is a medical error or some mistake. You have to acknowledge, yeah, if that's happened, it wouldn't be acceptable, or if that's happened, we will need to investigate more about it. Okay, but you will have to investigate first. Don't assume that the patient is right. Okay, so you have to investigate and to see. But sometimes it is mentioned in the station that a medical error have happened. Okay, and but you don't have enough information why this medical error have happened. Okay, this is a more tough situation. You have you have a task in the station to say or to reveal or to be open to the patient that a medical error have happened, but you don't have any clue why it have happened. Okay, so in this situation you will explain the medical error, okay, and explain that your colleague have done that and this was the medical error at that time. But the patient might ask why he have done that. So in this situation, you don't have a clear answer. So you will need to speak to your colleague. You will need to investigate, to tell the patient that you will investigate it more and to get to the bottom of it, why it have happened. Okay. So to cut long story short, the main point in angry patient or angry relative situation is to support the way you will tackle the station. I will get high score, and actually it is an easy station in the exam. Most people don't do well in this station, but actually it is very easy station in the exam, and you will know if you have done well in this station or not during the exam itself, because the patient will give you a good attitude if you done well in this station. But sometime there will be an angry patient to the last second of the station. Try to tackle it in a professional way and do it in this way, and don't care about what will be as I mentioned, he might be angry till the end of the station and you have done everything right in the right way, but he's still angry. It's not your fault. He's an angry patient, and even you might get a full mark in this situation. Okay, thank you, and wait for other video. And I have got a lot of message about online mocks. Actually, I'm very short of time, and I have a very big waiting list, but I still managed to do one or two mocks per week. So contact me with the day of your exam, please, and be honest with me. And according to the day of your exam, I will be able to find you a mock date. And I have been asked also to do videos about prescription. So very soon, in a couple of days, I will give a full explanation, a full teaching videos about prescription. See you and wish you a good luck.